I truly believe technology has a way to empower patients, a way to improve the quality and efficiency of care that they receive. And so that's why I'm so passionate about it. The work that I do, the advocacy I do is on the patient side. This is why I say this all the time, that we always talk about patients as third party, as external to us. We are all patients. It doesn't matter how you are today, in the past, in the future, a loved one, someone will, and you will come into contact with the healthcare system. The easier it is for you to navigate to get the care that you need is most important.
Welcome to Beyond the Weeds, the podcast where perseverance meets potential. I'm Josh Realm, public speaker, marathon runner, asthma advocate, and your host as we explore the intersection of health, fitness, and resilience. Whether you're managing asthma, chasing a new personal best, or simply looking for inspiration, Beyond the Weeds is here to show you that no challenge is too great to overcome. Together, we'll uncover stories, insights, and strategies to help you push beyond your limits. It's time to breathe deeply, move forward, and unlock your true potential, one step at a time.
Today, I'm excited to welcome Fahreen Walimohamed to the podcast. Fahreen is a health informatics professional with experience across hospital, home care, vendor research, and academic settings. She's passionate about using health information technologies to improve how care is delivered and how patients experience it. Right now, Fahreen works as an implementation manager at OnCall Health, a leading telehealth platform and patient portal in the behavioral health space. She also holds an academic appointment as an adjunct lecturer at the University of Toronto with the Institute of Health Policy, Management and Evaluation, where she teaches in the Master of Health Informatics program. On top of that, she's taught as a professor at George Brown College in their Health Informatics postgraduate program, published primary research in the digital health space, and spoken at major conferences like eHealth, HIMSS, and Future of Health Leadership, Informatics and Policy. Recently, she was also named one of the Peaks 2025 Emerging Leaders in Healthcare. Fahreen is the co-founder of Empower Speaks, a platform dedicated to fostering meaningful conversations and knowledge sharing in healthcare. Through Empower Speaks, she hosts Healthcare Talks, a podcast that brings together patients, clinicians, and tech enthusiasts to explore stories, innovations, and ideas driving change in healthcare. With that being said, Fahreen, thank you for joining us and welcome to Beyond the Weeds.
Thank you so much, Josh. So excited to be here today. Having this podcast takeover on each other's podcast. So super pumped for the conversation that we're going to have today. And thank you so much for inviting me.
So a little bit of context, I just took part in Fahreen's podcast, actually, which was super amazing. So we had a great conversation over there. Thank you so much for having me. And we're doing this podcast takeover. So now I'm having her on so she can give her insights in the style that I do it here. Now, we did meet rather recently. So last month at the Lung Summit, I believe it was, hosted by DIA Labs Canada at the Mars Discovery District in Toronto. You approached me after I had given my speech and we just got to chatting, talked a little bit about asthma and how it's impacted us on a personal level. And we just kind of went from there and we thought, you know what, we each have a podcast. Let's take this discussion onto there and continue the conversation.
Yeah, absolutely. Yeah, I couldn't agree more. So super pumped for both our sessions. Hope you all tune in to both of ours. Had a great conversation earlier and looking forward to this conversation.
Absolutely. So we'll jump into the first portion of the episode. So reflecting on a distinguished career, I think it's important for individuals listening in to know who you are. Fahreen, your career spanned clinical innovation, leadership, research, and advocacy. Looking back so far, what moments or projects have stood out as particularly meaningful or impactful in your journey?
Yeah, so I'll kind of tie one example where I was working in the home oxygen space. So I was working at ProResp Inc. They're a home oxygen company. And so basically, for those of you that aren't familiar with that, what happens is either your family physician or if you're in the hospital when you're discharged, your physician there will prescribe you oxygen. What that means is you may have seen that some individuals where you have your oxygen tank and then they'll have like a face mask or cannula or what have you so that they can use that to gather oxygen essentially. And so when I was working at ProRes, so the main clinicians that work there are respiratory therapists. So when I was brought in to determine the value of, how, home oxygen was contributing to the healthcare system. And so home care, for the most part, is privatized. There are some nuances. So it's been some time since I've been in the home care space, so it may have changed since then. But at that time, it was you were under the age of 18, over the age of 65, or the reason that you were seeking out care was because of a reason that you had spent in the hospital overnight for. And so that then in those cases, it could be subsidized. So when I was brought in, the project that I was leading was to determine the value that ProRes was demonstrating to the healthcare system. And so because we are privatized, there are other vendors in the market. And so how do we determine that? And so the way you determine was based on quality of life. And so how do you measure the quality of life of patients, right? So if they have COPD, asthma, you name it, the idea is to keep these patients at home. And so the way you're able to, the metric that we use is 30-day hospital readmissions or 60-day, 90-day, you name it. So what that means is when a patient is discharged, the idea is to keep you home. Because if you come back, that, in a more qualitative means that you are decreasing the quality of life of the patient. Because if they're in the hospital, they're exposed to other pieces, they're away from their loved ones. And as a patient, you want to stay at home. And so I went through all the data, and based on that, I was able to determine, how many patients were, experiencing 30-day hospital readmissions, 60-day, 90-day, you name it. Now, based on that, we were like, okay, some patients are being admitted back into the hospital, some are not. Now, how do we determine what's the difference? What is happening? Why are some patients going back in? Why are some not? Right? It could be some reason that's completely out of their respiratory condition. Somebody fell down, you name it. But as I was doing my research, and I'll be very high level here, what I determined was that the respiratory therapists that were conducting quality of life goal setting with their patients, they had a higher chance of staying at home as opposed to being readmitted to the hospital. So you may be asking, what is quality of life goal setting? So a lot of times when I say that, a lot of people think of SMART goals, right? So it has to be specific, measurable, achievable, relevant, timely. An example would be walking up and down the stairs 3 times a day, 3 times a week. Now, not everyone was completing quality life goal setting. So I did some qualitative interviews, and I interviewed, I think, about 30 respiratory therapists on the team. And so we spread out in Ontario, I think about 40 clinics. And I spoke to them. And the ones that were conducting it, the way they did it was they would ask a patient, hey, John Smith, how are you feeling today? And so they, will say, oh, I was short of breath, what have you. And so when they are setting them up on oxygen, they'll ask them, what is something that you enjoy doing? What is something that you like to do? And it may be as simple as, I would like to go downstairs and play cards with my friends once a week. Somebody else will say, in 6 months, I want to fly to Florida with my grandchildren. And so okay, if that's the goal, this is why we need to make sure that you do use your oxygen. This is why we need to make sure you don't catch an infection. So the idea is empowering the patient to see why am I doing this? I was prescribed X, Y, and Z. Why am I doing this? Because I want to do X, Y, and Z. So if it is to play cards, it is when I come to see you the next time I ask you, did you go play cards? Yeah, you did. How was your breathing when you went? Oh, it was kind of short. Okay, so now what do we do? And so it was through those conversations. And when I asked some of the respiratory therapists that weren't conducting quality life goal setting, what they told me was some of them were new grads. And so they felt very overwhelmed, right? So it came down to, training, shadowing other more seasoned respiratory therapists. Some of them felt that was not under their scope, that physiotherapists should be responsible for goal setting as such, SMART goals or what have you, that it didn't fall under the realm for a respiratory therapist. And so through that, we determined there were some knowledge gaps, some training gaps that we needed to do so that we could train the respiratory therapists so that they're able to conduct quality life goal setting at that level to prevent hospital readmissions for their patients. So I know that's a lot of information there, but based on that, we were able to see a decrease in hospital readmissions, and that's the goal, right? To keep patients at home. And so I think this was very early on in my career, but I remember that project that I was assigned to for till today. And I share the story all the time, how important it is, how those data points are important. There's so much more that I could share as well, but I would say that was one of the exciting pieces where I could see the importance of data and how we could have an impact, and where sometimes you do need to dig deeper, that you do need to ask questions. A lot of the times we shy away. And I can say even now in my career, I'm known, you can ask anyone that knows me, I have no issue asking a question. I will ask it even if you think I'm silly. I may not know what I'm talking about. It doesn't matter. I will ask it, because through asking questions is how I was able to determine what was happening, and had a very supportive team, and they wanted to drill down why that was. and to provide that quality of care to their patients. And the physicians that were, referring or have you could see that quality of care as well. And I think that's so important. So I'll pause there and hand it back to you.
That sounds incredibly rewarding. And it really shows that there is a correlation between, well, really for the respiratory therapist, knowing where that line is drawn, knowing exactly what their duties are, and how to go about them, and showing that those who kind of, I don't want to say go up and out of their way, but those who have kind of that close patient approach, I guess I could say, how those patients really had a much better outcome.
Yeah, no, absolutely. I completely agree. And I think to your point, it is also acknowledging that there can be gaps, right? There was a training gap. There were new grads that were, because there's a lot of paperwork that you have to complete in the first visit. You have to train how to use it because it can be dangerous as well. So it's oxygen, right? It's flammable, what have you. So you need to teach the patient to use it safely. So there's so much happening. But in addition to all that, now I have to do quality of life goal setting as well. And so I think to your point is acknowledging, like, okay, there's a gap. So how do we address that? How do we bridge that gap so they're not feeling overwhelmed? But we're still able to empower them, empower the clinicians, right? So it's twofold, empowering the clinicians. By empowering them, you can in turn empower the patients. And I think that's a reoccurring theme that we have seen, especially through the pandemic, right? Where there's a lot of clinician burnout. And so without empowering your clinicians, you will impact quality of care of your patients. And so it's a loop, right? So yeah, I think it's very important. Yeah.
As you mentioned earlier on in your answer, healthcare is evolving quickly. It's changed a lot. It changes all the time now, especially in the digital space. How have you seen attitudes towards digital health and patient empowerment change since you first entered this field?
Oh, wow. That's a loaded one. I think I've seen more positive kind of outlook towards technology. I do think there is a little bit of hesitancy as well. And I'm cognizant of that. But I do think there has been a positive outlook of it as well. So working in, I've been on the vendor side, I've been on the hospital side, on the home care side. I do think when you provide individuals with the tools and you are not forcing certain, whether it's a device, a mobile health app, what have you, where it doesn't fit. And what do I mean by that? Firstly, it's about workflow. So when we are, so one of the companies that I was working at, we are a communications app. And so it's like WhatsApp, iMessage, what have you, but it is PHIPAA and HIPAA compliant. So physicians, clinicians can talk about their patients and it is safe. If they take a picture of a wound, it doesn't save on their camera roll. And so they're able to have those conversations. Now, one of the organizations we were doing a pilot, a proof of concept with, they did not use WhatsApp and iMessage on their day-to-day. They use Teams here and there. They're a very unique clinic. And we tried to implement. So 30-day pilot, we tried to make it 60-day, 90-day. It made no difference because it was not a fit. And so I think it is in this state of so much change, various tools, apps, you name it, with AI as well, you need to be cognizant that there is a match, that there is a fit, that you're not just forcing certain technologies because you think it would be a good fit. I think that's where a lot of clinicians get overwhelmed. The other piece is change management. When you are bringing in something new, whether it is a patient's, where it's going to be impacting your patients, right? Because I work on the side where we have a patient portal, or on the clinician side, the admin staff, change management is important. And what do I mean by that? So you need to train your staff so they are aware of this. You try to simplify what workflows are actually going to change for them. Make sure that you are socializing to your clinicians, your admin staff, that, hey, this change is coming. Also your patients as well, like, hey, heads up, this is coming. And so you make sure that there is, I wouldn't say noise, but make sure there's awareness that this change is going to come. Sometimes it can be overwhelming. But I think when you have that knowledge and you have created that atmosphere where people are aware of this, they're able to navigate that, whether you're on the patient side or what have you. I think there's also digital literacy that does impact, I think, individuals that goes to social determinants of health. If you're from high socioeconomic status or what have you, you may be more tech savvy. But that being said, I think in today's day and age, everyone is, trying to make sure that they are aware and in the space. And so I think digital literacy is very important. So I will say, I do think when you have the certain parameters in place, it allows for greater adoption. But I think it does start that, what are you trying to solve? If you're just pushing in technology because you think it will look good or it seems good, that's a problem. You need to make sure there's a fit, there's a need for it, and you're just not, imposing various tools on your clinicians. Even on the patient side, right, where it's user-friendly for them to navigate what is the purpose of them having a patient portal, right? So they can access their forms, they get their appointment reminders, they can access their telehealth link. our app also has a messaging portion. So it's within the app. So it's PHIPAA and HIPAA compliant and all of that. So there are some benefits in there as well. And so I think to kind of close the loop here, I think there is a wide acceptance. There is some hesitancy, right? Being mindful where, with AI doesn't mean it's going to replace us. And I think in all fields, AI is meant to augment. And I think one of the clinicians, the CMI of sick kids I had on one of my episodes, and even he said, it's meant to augment our clinicians. It's not meant to replace. And so also for AI, for patient side too, where they can navigate with their health data and, all that to empower them as well. I think there's a lot to come, but not to ignore the fact that there may be some hesitancy as well. And that, once again, is knowledge that comes from training, whether it's the clinician side, the patient side. And so I think there's so much to come, but identifying that what are you solving? And if you are solving something, is this a right fit? And when you are trying to do that right fit, you are cognizant of change management to allow for adoption. So that's a long-winded answer. That's like all my expertise coming out, but that's kind of it there. Yeah.
So I'd like to move on now to digital health and chronic disease care. At Beyond the Wheeze, we often talk about how digital health tools can help manage chronic conditions like asthma. From your perspective, what role should digital health platforms play in supporting patients with chronic respiratory illness?
Yeah, absolutely. And so I think it's about self-management. So when it comes to these various tools, it's to help you manage your symptoms, understand what is happening. And I'll kind of walk through an example. I'll kind of loop back to when I was at ProRes and kind of walk through an example there. Alrighty. So basically, while I was there, we were trying to pilot a platform from Atonics. The platform was called A Touchaway. And the way the platform worked is every day. So it was a platform that was kind of created where every morning, the patients that were part of the pilot, it would ask them, how are you doing? Right. So there'd be a green face, like smiling, doing well, yellow face, not so well, and then red, not doing well at all, need to go to the ER. And so the respiratory therapist would help monitor that. So now when they said that, hey, red ER, okay, call 911, you're good. But sometimes not feeling so good. Why? What's happening? Right? So the respiratory therapist is alerted that, hey, this patient has said they're not feeling too good. And so they would ask them, what's happening? They'd be like, oh, I'm short of breath. I'm bringing up mucus. So that is an indication that, hey, this patient may have COPD or what have you, but it may be an onset of an infection. Right? So respiratory therapists cannot prescribe prescriptions, but they can be like, hey, you may want to see your family physician, or if you have a prescription already set at the pharmacy that you can just fill, so you can catch that infection early. Because if you don't catch the infection early, the patient ends up presenting in the ER. When they present in the ER, the chances of them coming back home, especially COPD patients, can be more geriatric patient populations. They're exposed to a lot more. The chances of you coming back home is a lot lower. Right? So that's where the self-management piece comes from, where you are, you're teaching the patient like, hey, you're bringing up mucus, you're short of breath. These may be signs that you are developing an infection. Right? So if you can catch it and be treated at home with antibiotics, why not? And so I think through the platform, it was a pilot. So basically what would happen is they would do pilot groups, they would provide tablets, pay for the data, all of that to help patients navigate and understand how to self-monitor. And so those were one of the examples where the respiratory therapist would be alerted on there and, hey, we maybe need to go see this patient today. And so I think that was the idea. That was the beauty of it. And so once that group of that pilot of patients was done, then we'd go to another area and another, because they provided the tablets, they paid for the data, because some individuals are in rural areas where the connection is not the greatest. But the idea was for self-management, right? So to teach you, and I think we even discussed this on my podcast earlier, where education is important. So I think self-management, where patients are learning, what's happening with their body, understanding your triggers, what is working, what is not. I'm bringing up mucus. Okay, maybe I have an infection that's coming on. Can I catch that early so I don't have to go back to the hospital? So I'm at home with my loved ones. Maybe I do need to take some care and rest to recover, but there's a greater chance of me recovering than going back home. And so I think even on the clinician side, using AI tools or what have you, like Bluetooth devices to, monitor your oxygen saturation levels. Okay, this patient is dropping. They have a dashboard, can catch on the, hey, something's wrong here, as opposed to waiting for it to be, extreme, where you do present in the ER or what have you. And sometimes you do, and you need that care. And that's why the ER is there. But I think it's so important to use these devices. And so when you say about chronic conditions, because it's chronic, right? What that means, it's for a longer term. So you have to learn how to live with it. Now, that doesn't mean, that the whole onus is on you, but for you to be an equal participant, an equal stakeholder in your care. Because a lot of the times it's, okay, my clinician, my physician, my nurse practitioner, my physiotherapist, my respiratory therapist, but you too are part of your circle of care. If you are empowered, you have some knowledge, like, hey, I'm bringing up mucus, something is not right. You can advocate for yourself. You can, help figure out that something's not right in my body. And then having that knowledge, empowering yourself, advocating for yourself allows you to do that. But it all stems from education and having the tools and the knowledge to do that, to identify that. And so I think that's where digital health tools can come into to help patients navigate the space.
Absolutely. And yeah, we did talk about that on your podcast. We talked about also the importance of patients advocating for themselves and their care, because our doctors might not know everything that's going on. Our respiratory therapists might not know everything that's going on. Every little piece of information might help them to understand and help you to understand as well. So patient advocacy, advocating for yourself is huge. It's very important. Virtual care, remote monitoring, and patient portals are becoming more common. What do you see as the biggest opportunities and challenges that these tools present for both patients and healthcare providers?
Yeah, absolutely. And so, because right now I work still on the vendor side. And so we are a telehealth and patient portal in the behavioral health, mental health space. And like you said, so virtual care, right? So basically the way it works is with an integration. It's integrated with the electronic health record. And so basically you will schedule an appointment in the electronic health record for your patient. And the way ours works is if the patient's email address or their phone number is in their respective profile, the appointment will sync, as well as other pieces, and it will sync into the patient's profile. And so that's where they will log into their portal, whether on mobile or a web platform, and access their telehealth link. They access it there, so it's PHIPAA and HIPAA compliant. But that being said, sometimes my clients will tell me, like, we have homeless patient populations. We have patient populations that don't have access to certain devices. And so how do you, navigate that piece? Right. But, initially we didn't have it based on phone number. It was solely based on email, and some patients don't even have email. And so now we can cater to, certain patient populations that don't have email. So even with the phone number, at least they get the SMS as an appointment reminder that, hey, you have an appointment, so that they can still be part of their care and still have access and have those reminders so they can access the care that they need. And so I think it's something simple as that initially we were just based on email. And so that it did not account for certain patient populations. But now based on the feedback we got, now we are accounting for phone numbers. So that way patients that don't have an email address or what have you can still get their appointment reminders and communicated to about their appointments so they can come in and get the care that they need. So I think that's one piece there, that sometimes even the pieces that we don't think of are important. Yes, email will capture the majority of your patient population, that it will capture people that do have access to smart devices, data, you name it, but there are patient populations that do not. And so I think it's very important that we don't forget about that and we do our best to navigate that. It will not solve everything. You will get pushback. Not all patients will be comfortable with that. And some of that comes with the education, but I think it is important where you have access. So all the forms that they're assigned are all in their portal. We have a view client data feature where their lab results, their diagnoses, their medications are all in there. And so I think that's important. One thing I'll highlight is sometimes because we are a vendor, we cannot withhold patient data from patients, but our clients can tell us, hey, we don't want certain data points shared. And the most common one I've seen is diagnoses, because they don't want to overwhelm patients. But I've had conversations with physicians where I broach this topic where it's important for patients to have access to their data. And so while patient portals are becoming bigger, I do want to highlight, if you have multiple patient portals, it also becomes hard to navigate, right? So if I am seeking out mental health services, so I have a patient portal for that. I had an injury earlier, so I have an ultrasound and x-ray, so I have a separate patient portal for that. And so that also becomes a bit complicated for your patients to navigate so many patient portals, right? And so we're aware of this in the healthcare system where there's a lack of interoperability. We are in silos. But still, that being said, I still think having patient portals is important. It's a starting point, even though they may not all be connected. But I think that would be the hardest hurdle to overcome, where all that data is congregated together, or aggregated, together. So it's easier for the patient to navigate as opposed to having various avenues. And I think virtual care, while it is very important and it has enabled a lot, I remember at a previous company that I was working at, the CMO, he was an emergency physician. He told me not everything can be provided virtually. A lot can be which is important, but some cannot be. And that's where you do need the physical care, where I do need to see you and what have you. So while it is beautiful, I'm very upfront and very cognizant that there are certain aspects of healthcare that are still need to be done in person. But virtual care does alleviate some of that, where, you know, if you're in a rural area, something is better than nothing, and still having access to care is very important. But I would say the patient data and navigating various portals can be a bit of a hurdle. But it's still important. The patients still have the data in their hands. Virtual care may not solve everything, so we need to be very realistic about that. But there are certain situations where it is empowering clinicians, it's empowering patients, where they can get the care they need, even if they're in a rural area. But it's also important to see on the flip side that, hey, not everything can be done virtually, and we need to be very real about that and cognizant about that.
That's a good point. And another way you could look at virtual care as well is it might be a comfort thing for some people. Like, I'd like to use, for example, I do therapy. Now, for me, going to do therapy in person, well, it's a comfort thing. I might not feel all apt to doing it if I'm going, you know, into this room, this strange room, sitting down on a couch and speaking to somebody I've never met. Now, if I could be in the comfort of my own home, which I am when I do my therapy, I just open my laptop. If I really need to, I can close that laptop and I'm back in my own space. So it opens up a lot of doors in that avenue as well.
Yeah, I think that's so key. Like, even us, I was talking to one of my team members on the customer support side, and she was telling me how she was, a gentleman, he was in his 90s, who had called in, who needed help just to log in. And because we're in the mental health, behavioral health space, it's just so wonderful to see an individual who is, a geriatric patient who is seeking out care that maybe, like you said, there is a lot of stigma around mental health. This way, nobody has to see that I'm going to see, my psychiatrist, or what have you, that I can still get the care that I need. So like you said, there are avenues where virtual care is amazing, that it helps address a lot of points. And mental health is one of those avenues. I remember when I was teaching, one of my students said, like, everyone's different. Some people will prefer that. Some of them are like, I like the face-to-face. Like you said, giving people options. I think that's the beauty. That's empowerment, where I can choose that. I'd rather be seen at home, or I like to go in person, have that rapport with my therapist. Everyone's different, right? So I think it's important to acknowledge that and be able to meet people where they need to get the care that they need as best as we can.
So we've talked a little bit now about patient data access and patient portals. You've co-authored research on enabling patient access to their own healthcare data, as we just spoke about. Why is this still such a challenge for many patients, especially those managing chronic conditions?
Yeah, absolutely. I think that's a valid point. And one of the pieces are, not every area has a patient portal, right? So some do, like certain, like with various hospitals, with their electronic health records, there may be a patient portal that comes with it. Even for us on the vendor side in the mental health space, we were acquired by a larger company. So the electronic health records we integrated with them. And so I think there's that one piece. The other piece is, even with the data points, how I shared, where some clients, they did not want their patients to see their diagnoses or what have you, because they felt that they may be overwhelmed. But at the end of the day, it is their data, right? So it can be very tricky. In terms of patients having access to their data, even right now, your family physician, a specialist you may be seeing, everyone is pretty much in silos. There are some avenues in channels to help navigate that, where you can access certain data. If you're seen in, the ER, then it's, looping back to your family physician, or if you're seen by a specialist, like trying to close the loop that way. But to have access as a patient is very hard. And what do I mean by that? So, for example, when I was, doing my master's of physiotherapy, I got injured, and so that's why I couldn't complete it. But at that time, so this is dating way back, I had to get an ultrasound and x-ray done. When I had that done, I asked, because I have high health literacy, I asked, can I have a copy of my x-ray and ultrasound? They told me I had to pay $10 for a CD. But because I was aware of it, I was like, sure, I paid for it. I shouldn't have had to, but I paid for it. And I kept paper record of my blood tests, my reports, everything in a folder. And when I went to see my sports physician, family physician, physiatrist, chiropractor, physio, you name it, I carried it with me. My sister, like I mentioned, is on the legal side. She's a lawyer. She had said, I didn't know, I would not have known to ask. Right? So there's also that gap there. Fast forward 10 years later, I got injured again. Magnet for trouble. And once again, my family physician ordered me an x-ray and ultrasound. This time I went, I got it done. I asked them, can I have access to my x-ray and ultrasound? They said, sure. They printed out a paper for me so I could access the patient portal. I had like a PIN, a code, so I could access it. But the key piece is I had to ask for it, right? Not all patients would know to ask for it. And so I think that's the piece there, where there's knowledge, health literacy, digital literacy. And so I think the key piece is, because when I was presenting at FLIP, the Future of Health Leadership Informatics and Policy conference, I had an audience member ask me the question. She's like, it is hard to navigate digital literacy. And so what you are saying, would you kind of propose similar to how you just asked me? And what I kind of told her is the patient should have access to their data. Whether they understand it or not I believe would be secondary. And the reason I say this is I have this injury, I have certain allergies or what have you. Let's say I go out west, I get injured or something happens and I present at a family physician, a walk-in clinic or an ER. They will not have access to my data. They're not going to know I have this injury. They're not going to know I have certain allergies because that data is not accessible to them, right? Because provincially, care is delivered provincially, so it's all siloed. But if that data comes with me as the patient and follows me, then they will know, okay, hey, Fahreen has this injury. Okay, X, Y, and Z. She's allergic to this. She's on these medications, all of that. And so I think the lack of interoperability, the silos. It's so difficult to navigate, determining who should have access to what is a whole nother conversation, right? We have the data in my current role and we can provide it to patients, but some clients, and they have their reasons as well, right? We have to be very cognizant. It's to navigate all that, but don't want to, release that data to the patient. So there's that piece as well. So I think there's so many moving pieces, but I think the starting point in the whole idea of doing that research and presenting that was to have those conversations on why it is so important and why patients should have access to their data, because that's how they can navigate it and get the care that they need. Even if you don't understand what all those data points are, it is important that you have access to it. So even if you go to a different province, you go to a different country, it comes with you. So your clinician cannot make an informed decision if they don't know all the data points, right? And so that's it's a very long-winded answer. I'm sorry, very passionate about this and all that. So that's why I kind of gave the whole story behind it all. But that's kind of my thoughts on this and in the importance and some of the gaps.
That's incredibly important. I'm a severe asthmatic who has lived in 4 different provinces over the last 15 years. I mean, that data, like you said, it doesn't transfer over. I'm in charge of really bringing that data to each province on my own. So that's huge. I mean, if we can bridge that gap and we can have that data somehow available between provinces, that would be incredible. Equity is something you advocate for in your work, Fahreen. How can digital tools be designed or implemented in ways that actively bridge care gaps rather than unintentionally widening them?
Oh yeah, that's a heavy one, and that's so important. I think being cognizant of who your audience is, and I'll give an example. So a lot of my clients, when it comes to their appointment reminder, so generally the language is in English, but a lot of them will tell me that, hey, we work in areas where we have large Spanish-speaking populations. So how do we navigate that? And so, certain features we've built that, some features you can, have the email also in Spanish or other languages, but it comes at an additional cost. But some of the features we do offer, like custom appointment reminders, you have access to that. You can build additional one, add additional verbiage, certain character limits, but that's one way to navigate it, where you give individuals the option to account for their patient populations where there may be differences, right? So if English is not their first language, but Spanish is, how do you navigate it so you are communicating to them in Spanish? So they can see their appointment reminder and be like, okay, I have an appointment coming, as opposed to feeling more far removed from their care, where it's just it's a gentle reminder to let them know, hey, you have an appointment coming up tomorrow or in 3 days from now, right? So I think that's one piece where we are cognizant of language barriers, right? In Canada, we are very multicultural, very diverse. So being cognizant of that, right? We have a lot of immigration. So being aware of cultural differences. And not just in terms of immigration. When we talk about our history, right? We have Indigenous individuals. Culturally, they're different, the way their care is. I've attended some seminars where I've had individuals that are Indigenous, where the way they present when it comes to their care, it's a little bit different, right? They have more holistic means, they have more traditional means of medicine, which is still important, right? So we have Western medicine and all that, which is important. But how do you integrate with the way that they provide and seek out care, right? As opposed to shutting it away, being open to it on how they seek out care. And I think having various patient and then I think that goes to what we even discussed. We're having patients at the table, being cognizant of, I think like low-hanging fruit about like language barriers. Okay, so even our portal, there are other languages common. So there's French, English, I think there's Portuguese. There are other languages. I think there are a couple that at the top of the portal you can change. So it's in a language that you're familiar with. I think that's number one. I think that's low-hanging fruit. But I think having patients at the table when it comes to equity, like I said, for example, Indigenous patients, populations, right? How they seek out care, right? To navigate that so you are aware of what is important to them, how you have those conversations, I think is very important so that they can seek out the care that they need that is comfortable to them, that is in alignment with their culture, with their traditions, but still seeking out the care that they need in a comfortable, respectful manner. And so I think it goes back to what we were talking of having patients having a seat at the table to make it equitable, being cognizant of social determinants of health, right? And so we talked about, like I said, similar to yourself, my sister also has asthma. And so inhalers are very expensive. And so having physicians or whoever your clinician is asking you, do you have insurance? And if they do have samples, to provide that to you. I think it's that education piece as well, where clinicians are aware of, hey, social determinants of health is real, right? Socioeconomic status is real. How do we navigate that? Even the pandemic, we were like, okay, individuals living in, close quarters, they are going to be impacted. Individuals doing X, Y, and Z work will be impacted. I think it's important to be aware and what we can do to enable them, empower them. And I think it always starts with conversations. I think even on the news during the pandemic, that was being made aware. So individuals were, okay, I am living in close quarters. Okay, X, Y, and Z. I'm living here. Okay, this can impact me. I think is important. It may not solve everything, but I think awareness is important, making sure patients have a seat at the table and we are accounting for the multiculturalism, the diversity that Canada has, also respecting our history as well, making sure Indigenous individuals and patients have a seat at the table as well, and accounting for their traditional medicine, I think is so important. And I'll kind of just leave off with, even when we're talking about the pandemic, the vaccines, right? There is some, various populations that had a little bit of pushback because they weren't comfortable because of history. So I think it's so important to have those conversations, having people in those respective populations speaking up, advocating, because they will understand those pain points. And like similar to yourself, right? Being an individual with severe asthma, as opposed to me talking about it, you sharing your story, you having those lived experiences allows people to open up, to have those conversations, right? So I think it's so important. I can keep going on, but I think just those are some tidbits that come to mind and nuggets that I think are very important to be equitable and to have those conversations, at least as a starting point.
So I had Dr. Paul Pianosi on, I believe it was episode 15, and he discussed just that. He discussed having an individual from that perspective, cultural background in the room that also works in, say, the healthcare space. That way they can be there, be present to help connect the patients to the healthcare providers as well. And he brought that up as kind of a gap that should be addressed at some point in the future, and something that we're lacking, unfortunately, and that we need to work towards.
Yeah, and I think it's even as something as like even between gender, right? Like when we talk about heart attacks, well, the general knowledge is that when you're having it on your left arm, you're having a stroke or what have you, or heart attack. But when it comes to women present differently. And so the bias there is when research was done years ago, it was predominantly men. And so the research wasn't done on women. So even when we do research trials or what have you, being cognizant of those biases, even when we're introducing technologies, being cognizant of those biases. When we are training AI models, the data needs to be representative of that population, right? So sometimes we talk about, like when I was doing research for one of my papers where it's making AI reality in the province of Ontario. And one of them was, because, the States does have more resources and what have you, that maybe we could use a vendor from there. But their AI models will be used based on their populations. Right? So they're a privatized system, we're a public. So there's so many nuances. So even when we're talking about AI, the AI that is the data that's training that model also needs to be representative of your patient populations. And so I think there's so much there. I feel like it's opened a can of worms there, but like just being cognizant of that is something as simple as that there are layers to it that we need to be at least cognizant of. We may not address everything, but we need to start somewhere.
So I'd like to move on now to leadership, advocacy, and empowerment. You founded Empower Speaks to challenge healthcare norms and spark tough conversations. What are some of the most important conversations we need to be having right now when it comes to patient care and health system innovation? Yeah,
no, I think that's an amazing question. And that was kind of the idea of having the platform Empower Speaks and starting the podcast, Healthcare Talks. It was to bridge that gap, right? So, being in the healthcare space, I do have access to certain individuals. And being able to bring them to the table to navigate these difficult conversations. Some of the conversations I had, it was about AI, right? So we are having how can we use it? There is some hesitancy, there is some excitement. How do we navigate that? is it going to replace our clinicians or what have you? In healthcare is not the only industry, whether it's education, other avenues as well, where we are concerned what will happen with AI, and we need to understand how to work with it and that it's going to augment us. And so in terms of that, the platform was to build that. I love and I'll be very open about that too. I love public speaking. So I've spoken at various conferences. I've taught. One of the panels I moderated was on the front cover of the Canadian Healthcare Technology magazine last year. And it's a passion that I have. And whether it's my students, whether it's audience members, when they've heard me speak, they have told me themselves that they enjoy it when I speak and when I bring that energy and when I'm able to disseminate certain information. And so also having the ability to pick the other party's brain, right? So when I bring these guests, I'm able to pick their brain and have these difficult conversations. And what better way than to have a podcast, right? And to have that. And so whoever, is curious about it or is trying to navigate it can access that. It's readily available to you. And so that's where it kind of, to bring my expertise to the table on how to serve for the greater good and pay it forward. When it comes to the teaching, I think that too is a form of leadership to help train and teach the future, right? And so a lot in school when I was there's a lot of theory. Theory is important, but also practical. So I try to share those experiences. And I think that's also a reason why I love doing this. I was at a gala, healthcare innovation gala, I think a month or two ago, and two of my students had attended. I had asked a question at the end, and one of my students came to talk to me, and she's like, "Hi, Professor. I couldn't see you because I was a little bit at the back, but she's like, I could tell from your voice it was you." And I was like, "That's incredible." And she's doing well. And so seeing that, one of my other students, one of the panelists was on my podcast, Dr. Mohammed Mamdani. He's at Unity Health Toronto. And she said, while I was driving here with my girls, I made them listen to your podcast so they knew all he has done and so that they could enjoy the gala, the panel. And so hearing that is what kind of drives me. And I think it's important to have those conversations. And I think it's leadership in an informal format. It is thought leadership. The last piece I'll kind of share here is when I had a gentleman from London, England. He messaged me on LinkedIn and he's like, "I was YouTubing certain AI things and I came across this episode of yours. I listened to it, really enjoyed it." And so seeing that crossing borders as well. So I think the idea of Empower Speaks is meant to empower. It's to share that knowledge, whether it's in a teaching capacity, whether it is through the podcast, empowering others to have these conversations, having somebody from another country reach out to you to be like, "Hey, we're having these conversations." It's important in every country. So I think that's kind of how we've used the platform outside of healthcare as well. We hosted our first event, which was an International Women's Day event, to have conversations on how to fill your cup outside of your 9 to 5. And so it's important to look, and when we talk about healthcare, we talk about your physical, your body, but there's more pieces to you. A patient you have to view them holistically, their quality of life, where they're living, their education, their culture, their ethnic background, all of that is part and parcel of it. And so at Empower Speaks, in addition to having these conversations, we try to have these other difficult conversations that may not directly be linked with health, but are important to be had so we can have these conversations and look at an individual as a holistic human being. And so I think that's kind of the goal with Empower Speaks. I can go on, I'm very passionate about it, but just wanted to share some of those nuggets and stories that really brought a smile to my face. And so I just wanted to share it with others as well, that even if you're impacting certain individuals, pockets of individuals, that's okay. That's the goal. And so I would say that's kind of what we're aiming with Empower Speaks.
I think that's incredible. And it shows, and your passion for what you're doing clearly shows. And you're obviously an amazing speaker. I love hearing you talk, and you can answer these questions as long as you'd like. And I will sit here and I will listen and I will eat up every single part of it. I think it's great what you're doing. I think it's important. And, maybe I can get some tips from you, because I'm essentially trying to do the same thing. Have those difficult conversations, get those people's knowledge out there that otherwise might not really be out there. I mean, they're good at what they do. Everybody I have on, they're amazing at what they do, but it's getting them heard and bridging the gaps between the patients that they look after, I think is incredibly important. So that's why I do what I do. I feel like you could write my podcast description and we would pretty much line up somewhere right there in the middle.
Yeah, no, absolutely. And I think it's wonderful what you do, because I've also listened, I think one of the recent ones where it was a family that had lost their child who had asthma. But I think it's so important. It's hard to have those conversations. It's hard to listen to, but I think it's so important. And I think even the way you ask your questions and giving a platform to these individuals to come forward, right? Whether it's a physician who is retired now from the Mayo Clinic, but still allowing him a platform to share his experience. So another physician that is training in respirology can listen to him and be like, okay, I may not have access to this physician in today, but I can listen to that knowledge and pull from that so I can apply it to my patients. So I think you're doing an incredible job. Love the questions. Like they're making me like kind of go through layers of my brain, but loving it. So yeah, I'll hand it back to you.
No, I appreciate that. And going back to the Prince family, they did have their 8-year-old that unfortunately lost his life to asthma. It was a really difficult conversation to have, and they were incredibly difficult questions to ask. I mean, you're asking a grieving family to lay out that day, what that day looked like that their son lost their life. That was hard. Those are hard questions, and those are hard answers. But I think it's important to give people that platform because we're going to learn from those stories. Everybody's going to learn from those stories. And the way that they looked at it, and I couldn't agree more, is it's given their son a legacy. Rudra is going to live on, and they're going to make incredible change. Change is going to happen because of that unfortunate story. And as you mentioned, having Dr. Pinosi on, yes, he is retired, but, he also worked at King's College in London. He worked at the Mayo Clinic. So he saw what it was like to work under different healthcare jurisdictions. I mean, he brought up something so cool that I never even would have thought about when he was practicing at King's College London. So it was part of a healthcare team to have a psychiatrist be in the room with the patients, the caregivers, and the doctor as well. Because as he mentioned, there are a lot of things that I miss because yes, I'm a specialist when it comes to this, but I'm not a specialist when it comes to what's going on at home. And they were there to ask those questions that I probably wouldn't even have ever thought about. And he brought up a really good example. He said he had a 10-year-old, I believe it was a 10-year-old girl that was a frequent flyer in the emergency room. She had severe asthma, and she would wait to the point where she couldn't stand and she would collapse and have to take an ambulance to the hospital. And it reminded me a lot of my childhood. Now, something that they never would have guessed in a million years is her mom was suffering from, I want to say it was like a debilitating anxiety disorder, very high anxiety. And that 10-year-old girl was so scared to put her mom in a stressful situation that she would allow herself to get to the point where she would collapse and have to be brought into the hospital because she didn't want to hurt her mom. That's terrifying. And as he pointed out, that's something he never even would have thought about. So having these conversations with people, whether they're retired or not, they bring valuable information to the table and information that we could use here in Canada or they could use in the States and vice versa, right? I think it's incredible. I love highlighting that. I love highlighting their years of work, their years of service in that field because, I mean, at some point, the teachers need to become the taught.
Yeah.
That's just the way things work.
Yeah, and I think piece that you really highlighted was caregivers. We talk about the healthcare team, like we talk about their providers, we talk about the patient, but sometimes we forget about the caregiver. They're also very important. When I was working at Sick Kids, being cognizant that the patient comes as a whole is a package, right? So whoever their caregiver may be, it may be a parent, it may be somebody else, an aunt, an uncle, you name it, a legal guardian, what have you. It is being cognizant that when you're treating a patient, especially a child, and not to be exclusive, but a child pediatric patient populations, geriatric patient populations, because caregiver burnout is very real. And I think it's important to have those conversations and be aware that you are looking at the family as a whole. And like you said, where that physician mentioned having a psychiatrist or what have you in the room to be cognizant of that. I think also having a social worker, what have you, to navigate other aspects, like in your care team, why it's so important that maybe you need help with certain access. That you may not be aware that there are resources that can help them. And so that's why it's important to have an interdisciplinary team where there are various avenues that they can help a family navigate. It doesn't just have to be a child. It can be geriatric, anyone, any age. I think caregivers are important as well. Caregiver burnout is also very real. And so I think it's important having those conversations. And one piece I'll also tie in is caregiver burnout is real, but also as a patient, when you're navigating a lot of appointments, sometimes having someone with you, sometimes you can't have that, and it can be a luxury and a privilege to have somebody with you, but it is important. And I'll share even with I've shared about my journey, my injury or what have you. Sometimes I will be in an appointment, even though I am I'm in the healthcare space and I have high health literacy. Sometimes I will be trying to process all that because it's to do with myself. It's very personal. That sometimes having my sister there to ask me questions is important. And the reason I say this is because when I was doing my master's of physiotherapy, one of my professors, she said, my child had a certain condition. He was at Sick Kids and he had to be suctioned. And so that's when they pull like a tube down to take out the mucus or what have you. Physiotherapists are licensed to do that in addition to nurses or what have you. She said the nurse that was doing it was not doing it correctly. She's like, I knew how to do it, but I froze because it was my child. He's doing okay. He's good now. But she's like, I was trained in this and I couldn't even do it. She's like, I froze even though that was my child. I knew how to do it. And the reason I share the story is to kind of just highlight that having a caregiver, having someone present there is important. So sometimes you as a patient cannot ask those questions because you're overwhelmed, but also having the caregiver there, they have their own journey, their own story as well. And I think it's just important to share that as well. So I just wanted to share that tidbit.
That's great. And as the patient too, it's important to know that your caregiver is often going at great lengths to be there to help you. And it's something I didn't think about till years later, but my mom has severe asthma. So my mom would bring me into the hospital and my mom would often be having an asthma attack of her own. But of course, I was her child, so she had to look after me first. But important to know that, like when you're on an airplane and those masks drop from the ceiling, you got to put yours on before you can help somebody else out. Or else, what good are you? How much use are you going to be to that person if you can't function yourself? And it's guilt that I live with today. I want to say today, my mom is not in a healthy situation when it comes to her lungs. And I'm sure it was the exact same when I was younger, but I didn't pay attention to it. So it's challenging. So very, very important to appreciate your caregivers and to not forget as well that they might be bearing something of their own.
Absolutely.
So I'd like to move on to personal reflections now. What motivates you to continue pushing for better, more equitable healthcare systems? And was there a specific experience or personal moment that sparked your drive for this work?
Yeah, absolutely. I think one of the pieces was my journey. When I was doing my master's of physiotherapy at the University of Toronto, I got injured. And I know I alluded to this earlier where I asked for copies of my x-ray and ultrasound. I carried a paper file. And so I firsthand experienced that as a patient. I consider myself someone that has high health literacy. And even I struggle to navigate the system. So imagine someone who didn't have high health literacy or just health literacy in general, how they would navigate. And so that's kind of what brought me to health informatics. And so that's when I went to U of T again. I'm a U of T veteran from undergrad. Like I just never left and now an adjunct lecturer. So just have continued. And I decided to do my master's in health informatics. It was from a personal journey. The reason that I do what I do is I truly believe technology has a way to empower patients, a way to improve the quality and efficiency of care that they receive. And so that's why I'm so passionate about it. The work that I do, the advocacy I do is on the patient side. This is why I say this all the time, that we always talk about patients as third party, as external to us. We are all patients. It doesn't matter how you are today, in the past, in the future, a loved one, someone will, and you will come into contact with the healthcare system. The easier it is for you to navigate, to get the care that you need is most important. Now that we have technology, there's a layer of complexity as well. And that's why I think having your health data is so important. Anything in life, you cannot make an informed decision. Even if you're trying to figure out, purchase, you're going to the grocery store, you don't know your budget, those are data points you are missing. You don't know how much balance you have on your credit card or your debit card or what have you. You cannot make an informed decision of whether or not I can afford this. You could try and then it might get, canceled or declined and that will tell you, but that's the hard route. So same with the patient, right? If you don't have all those data points and you don't know that they're allergic to X, Y, and Z and you prescribe them that and something happens, that's the hard way. But why go that way, right? And so there are cognizant of all those layers of complexity, where in lack of interoperability, silos, there's so much that needs to be navigated. But I think that turning point in my career, it changed the trajectory of it. But we're here today. I've navigated very strategically, being on the home care side, hospital side, academia, research, vendor, to make myself as an individual to navigate and have these conversations with individuals to understand how to better navigate. My goal is by the time I retire, I'll have left the healthcare system a little bit better. Still trying to figure it out, but that's the goal, that I will leave it as such. I think what also drives me is that being cognizant that there are other factors at play as well. Like even when, being in the implementation space, sometimes we are so focused on just implementing, being aware of the workflow, that there are also external factors as well. And so bringing light to that. So you want to implement something, you may have the buy-in, but there may be other aspects of it. And I'll give a very quick example. When I was working with the vendor where we're trying to implement a communications app, which is HIPAA compliant, the clinicians were in because it made it more efficient for them. But one piece to be aware of is in hospitals, our physicians are contractors. They are not employees. And so they can use personal devices, right? Because it's a like WhatsApp or iMessage. So you download the mobile app. You can use it on the web device, but the most accessible way is on your phone. But our nurses are unionized. And so how do you change that policy, right? You have to go through their union and all of that. Who's going to pay for them using their personal devices or their data? Are you going to provide them corporate devices? So there's so much. And so I think being on the patient side, being advocating for that, also being on the implementation side where there is value, where sometimes it's not a match workflow wise, but then there are other factors that you have to play with, other policies that are outside of the product that you need to be aware with. And because I'm very competitive by nature, I'm like, okay, how do we make this work? What else can we do? Is it feasible? What else? And it helps me learn what are some of the other challenges that may not be very obvious that this is an issue. And so I think it's important. And so I would say very early on in my career, what happened is kind of what brought me here today. My goal was different. I had even my practicum at Princess Margaret. I was going to specialize in oncology, but look at me today. I'm here. So, it's a different trajectory, but very happy about it. Even the teaching opportunities I've had, I love seeing the impact of that. I love seeing the impact of the podcast when even one individual reaches out to me. And so that's my drive, is to keep going. I will leave the healthcare system a little bit better than the way I found it. Don't know how, but going to keep at it and hopefully be able to make a change, even if it's in one person's life. Yeah.
I love that outlook. And I got to say, I kind of mirror the same thing. You never know where your passion is going to lead. And at some point, you don't even know what your passion is yet. I'm still trying to sort out mine. I mean, I took environmental in school. I then started working towards my undergrad in earth sciences. And now I'm kind of going down this pathway here of, I guess you could call it patient advocacy in a sense. And I'm in love with it. And I don't know where it's going to take me, but I'm going to ride that the entire way there, wherever that there is.
Yeah, no, I think that's so important, right? Like, I think also being open to life, letting your experiences shape you. Like you said, like sometimes I ask that question too, what is my purpose? I know I love public speaking, but what else? Like, you know what I mean? And so you try to what you're passionate about, what, like for me, when I'm public speaking, I come alive. Like I have like an adrenaline rush. Like when I'm on stage, I'm like, yes, right? But it's also whatever I'm knowledgeable on, how do I bring that to the forefront? How do I allow others to do that? Like kind of how you're having these conversations with the podcast, like you said, to ask those questions and be open to help someone bring that to the forefront. Without asking those questions, they may not even know they have that knowledge to share, and that is important. So I think it's so important, even like you said, that story with the family that lost their child. It is hard to have that, but to have those conversations and ask those difficult questions so that maybe somebody else who also has a child that has severe asthma, how do I prevent my child from going from that? By hearing, okay, those signs at the beginning of the day, this is what happened. If my child goes through that, I know, okay, this is what I need to do, right? But it's by having that story, by having that conversation. And so I think, like you said, having your purpose and allowing life to take you where it wants to take you. And I think that's very valid and very true. I'm on the same path, trying to figure out my purpose too and trying to go with it. But trying to bring my passion and knowledge to the forefront where I can for the greater good, I think is important to be fulfilling and to fill your cup that way. Yeah.
Before we wrap up, Fahreen, is there anything else you'd like to share with our listeners? Perhaps upcoming projects you're excited about, ways to get involved with Empower Speaks, or resources you'd recommend for those interested in digital health and patient advocacy? Really, anything at all, now is your chance.
Okay, no, that's awesome. I think in terms of Empower Speaks, keep, listening to our podcast. If something it may not be everyone's cup of tea, and that's okay. But if there is something that does resonate with you, please do listen to it. If you have feedback, open to hear it, please do share it. Through Empower Speaks, like I mentioned, we did host our International Women's Day event. We are planning to host a lot of others to have, facilitate that knowledge, have those difficult conversations that you can't easily have. And we're open to thinking out of the box. So if you are open to it, please do join us. If not, that's okay too. Like I said, being very upfront as well, you will not be everyone's cup of tea and everyone will not be yours. And that's okay. And that's life. But if it is something that would be of interest of you, do follow us, do kind of keep a lookout. We'd love to have others as well. I think it's important to have these conversations and to learn. And we use that feedback to be able to address those needs. For a very long time, I was trying to bring a patient perspective because it's hard to have those conversations. But somehow going to the Lung Summit introduced me to Josh, and he was so open to have that conversation. So I could have my first patient perspective. And I think it's so important because I had a lot of clinician, entrepreneur, but why not the patient side? And so I was able to bring that. So I think that is so important. I think in addition to the Empower Speak space, I think just in general, the digital health space, if you are interested in it, the way I navigated it was through health informatics. I think podcasts, just kind of seeking out what interests you. I think sometimes it can be from a personal journey. Sometimes it can just be of interest. I have a lot of friends that are engineers. They're like, I want to come into healthcare to have that impact. And so I would say listen to the podcast. I've had like co-founders or have you that are engineers who are, some are with a clinical background, some are not. So I think knowledge is so important. Knowledge sharing is important. That's the goal of Empower Speaks, and same with what Josh is doing with this podcast, Beyond the Weeds, as well as other work and advocacy work that he does. I think it's important to be open. Like I shared my journey. There was a time in my life that I didn't want to. I was ashamed of sharing what had happened to me. But now, years later, I can confidently, with my head high, say what happened, and I'm okay. I'm doing okay. So even if you're going through something that isn't the easiest right now, I promise you there is some light at the end of the tunnel. You may not see it. Me, it's been 10 years now, so very long, and I'm dating myself again, but it's different now, right? And so now I'm able to share that story, and if it's even able to help one more person. And just in terms of digital health, I think there's a lot out there. There's a lot to look out for with AI, and I think keeping the mindset that it's meant to augment, and that we're all learning. When it comes to AI, I think that's another piece that we need to be very aware of, that we're all learning. Nobody knows what it's going to look like, right? Even the example we gave earlier where cars, before it was just bicycles or horses pulling carriages, we didn't know what was going to happen, and we will learn with it. That's part of life, being able to adapt, being flexible, right? Through cars came the need for gas, and then from that came a need for natural resources, and then it came pollution, and then we have global warming. Like we don't know what the effect will be, but we go with it and we learn and we try to be as cognizant and have conversations early on to navigate that. So it's just been a pleasure, Josh, to share my story, share my knowledge, and giving me this platform to even share my platform, Empower Speaks, and get the word out there to even reach that one person in your audience. So thank you very much. I hope everyone in the audience enjoyed it or learned something through this conversation. And just thank you so much, Josh, for giving me this opportunity and agreeing to have a podcast takeover collectively.
Thank you, Fahreen. I appreciate that very much. And going back to AI as well, I mean, we see AI as the future. But AI is not going to be it. There's going to be something after that, and then something's going to come after that. We can only advance and learn as we go. So I do have one final question for you, one that I ask every guest on my episode. Whether you have asthma or not, every breath we take is a gift, a reminder of our resilience, our drive to keep going, and our power to define our own limits. With a single breath, you have the potential to move mountains and change the world. So with that in mind, I have, again, one final question for you. If you had only one last breath, but with it the power to influence the world, what would your message be?
I would say your body is your house. And with that one breath, whatever your body tells you, listen to it. And what do I mean by that? Sometimes when you walk into a room or you're in a conversation with something, I know we say it's a women intuition, but I think we all have that gut feeling where your body will tell you. And sometimes, yes, we can grapple with it, saying that it may be anxiety or something, or I was just nervous, but your body has a way to protect you. So with every breath that goes through your body will tell you if something is not okay. And I would say in my journey now that I'm more seasoned, your body has a way of kind of warning you, has a way of protecting you. So with every breath, be gentle and kind to yourself, and understanding that that breath that is coming in and out of your body is protecting you. So if you feel a certain way, your gut is telling you, this is for me, this isn't for me, listen to it. Sometimes we try to rationalize it with our logic. Sometimes things are not logical. I think now that I'm older and more seasoned, I've learned that your body will take you and will help you understand this is the room for me, this is not. Sometimes, even if that room ain't for me, I'm going to create my own table, right? So that's why where the whole podcast and everything came over, to give myself a platform, because I love public speaking. Why wait for somebody else? And I experienced imposter syndrome or what have you, but I was like, what's the worst that's going to happen? Nobody else listens, I'll listen, right? So I think that is what I would leave the world with, that single breath. Your body is meant to protect you. Your gut, listen to it. Don't always try to rationalize it, because then that's when you get in, you try to convince yourself elsewise. Sometimes your body's protecting you, so learn to trust it. It is a muscle. The more you exercise it and you listen to it, it will protect you. Whether it's a career change like I had to go through or what have you, just listen to it. So I think your body is your protector if you allow it, and it is a muscle that if you exercise it with that breath, that it is protecting you, you will be able to navigate the life you want as best as you can, being mindful of certain things. But I do think your breath, your body protects you. Listen to it and lead the life that you want, that your body knows is safe for you. Not safe as in taking risks. I mean, safe that this is home. This is what you need to protect. And it will open up doors for you, what is right for you and what is meant for you. And be grateful for that breath, and be grateful for the breath going through your body, and for those signs that it's giving you when you are in the right place and when you're not, because it will lead you where you are, so you can easily take that breath and navigate it the best as you can. So yeah, I will leave the world with that.
Fahreen, thank you for sharing your insights, passion, and vision for the future of healthcare. Your work in digital health, patient advocacy, and leadership is already making a difference, and it's been a real privilege having you on the show. To our listeners, if you found today's episode valuable, please subscribe, share it with someone who might benefit, and leave a review. For more on Fahreen's work, Empower Speaks, and resources on digital health and patient advocacy, check out the show notes. Until next time, keep moving forward, breathe deeply, and never let anything hold you back.
Thank you for listening to Beyond the Weeds. If you enjoyed this episode, don't forget to subscribe and share. Follow us on Instagram at Beyond the Weeds, or follow me at the Asthma Runner for more updates. Keep breathing strong, and remember, your potential has no limits. Until next time.